Very good morning, friends. Now, the discussion about vertigo. Vertigo, it is a disease caused by the inner ear troubles or ear inner problems or inner ear disorder. So, very frankly, I want to tell you the young generation mostly having such kind of problem with any age, especially in old age. So, vertigo, it's not a fall disease, but you can say it is a type of willing to fall. The patient understand that I am going to fall. So that's why it is known as the vertigo or vertigo. The causes are obviously many more causes. Number one, Meniere's disease. What is a Meniere disease? Meniere disease, it is that some obstruction or you can say the mismanagement of the cochlea. When your mental disease and your otitis problem, prolonged ear disease corrected together, that time it is known as the Meniere disease. This Meniere disease causes of mania means mental disorder to the problem added with ear troubles. When both are connected, then the vertigo is started. Also, it is known as Meniere disease. Then vestibular neuritis. Vestibular neuritis, it is also known as leveritis because you know that the inner ear, the small veins, or there is a canal, it's known as semicircular canal. It has a fluid. The fluid has disbalance. That's why is known as neuritis because of some neurological problem or maybe some inflammation through our ear. Then head injury. Head injury also a major cause of vertigo. Long term of head injury, patient at least fall in very tension and anxiety. That time they feel the vertigo. Brain disease especially I tell you, if you have brain disturbance like as neurochemical disorder, brain tumor, shock, brain injury, or any kind of stroke history was there, with the long term of medicine for brain, that time the vertigo has started. Then I told you that intrasemicircular canal contains a fluid whose name is semicircular fluid. That fluid is disbalanced because of many more causes, maybe injury, maybe Meniere's disease, maybe fall disease, maybe injury. That time when the liquid, the fluid is changed its position, it is mismanaged, that time vertigo started. Neurological issues, if you have mental problem or others neurological issue in your family history, in your genetic history, then we also find the vertigo is essential. The injury of the inner ear, the especially tympanic membrane. Sometimes that we itching with many more hard sticks. That time the sticks, that it can damage our tympanic membrane, and with the damage of tympanic membrane, then the second inflammation, third inflammation has started, pus, abscess, okay, otitis media. Then also we got the history of vertigo. Then prolonged illness. A patient having long-term illness, it means he has diabetes mellitus, he has many more other disease, cardiac disease, okay, any more cancerous disease. If the patient is throughoutly continuing the anti-cancer medicines, anti-cardiac disease medicine, or any other disease medicines, that time the side reaction or side effects of the allopathic drugs, it has started vertigo. Then insomnia. Insomnia, you know that the sleeplessness also a part of vertigo, a long-term sleeplessness, or if you are addicted with the sleeping pills or any kind of bad habits like alcohol, okay, narcotics, then also we got the history of that is the vertigo. And after all the very old days, the people of Generian, Natogenerian, Octogenerian, means 70 above, 80 above, 90 above, or centurion, that time ultimately the brain, that going to dry or atrophy. And with the atrophy of the brain, okay, that time the semicircular tunnel, the contents of semicircular fluid, it also percentage get less, that time vertigo started. Somehow, that many kind of other idiopathic causes, that also causes of, suppose one of my patient I got before 10 years back, that the patient drowned into the deep water, okay, near about 20 feet deep water, and when he come out, that time both tympanic membrane has damage and the water turned into inside, and after all the doctors implant the tympanic membrane with huge amount of rupees, but after all the vertigo is started. Then it has cured by yoga and naturopathy and homeopathy also. So by the way, these are the most common factor that vertigo, but you don't worry. If you have hypertension means if you have blood pressure, long-term hypertension also a causes of that is the vertigo. So along with all this history, I would like to say vertigo is absolutely curable, but you don't make yourself hurry or busy or frustrated. You just wait, be faithful with your own few exercises there, and also with homeopathy we can cure many more disease like vertigo. I am going to show you where you find in repertory. That is, you see, vertigo chapter from page number 96, vertigo forenoon, noon, afternoon, that is time modalities. First it is the general symptoms, then time modalities, okay, then general modalities, okay. Few best point I would like to say. Yesterday while my talking I am telling you that height phobia, or the patient thinks the higher building, more height building will fall him, where you will get this rubric, it is in vertigo, and you will find here as if high object leaned forward and would fall on him, that is arnica and sevadilla. Also the second rubric is as if high walls would fall on him, only the argentum niticum and sevadilla. This is the good. Even also headache, vertigo with headache the vertigo is started, many more medicine, apis, belladonna, conayam, calcarea cup, nux vomica and silesia, okay. Another many more rubric that you see, mental exertion, that is menarche disease, okay. And this is a concomitant symptom, concomitant menses during vertigo or before, that is the very more medicine is here. Motion during movement. Also I am going to say, see, rising from bed, amelioration after bed, from bed, this is a common factor. Maximum vertigo patient, they say when I am just rising from bed I feel vertigo, okay. From stopping, sitting while, many more rubric you will find here. On another good rubric that I am going to show you, that is on looking up a revolving object, okay. When you look up, that time you see the everything is revolving. On moving the head, even if you turn your head, then also you feel vertigo, okay. Vomiting amelioration, many more medicine, Veratrum alb is one of the good medicine, okay. Walking while, vertigo, many more medicine, that is natrium, nux vomica, phosphorus, plumbum, metallium, pulsatilla in fast grade. So friends, I don't want to talk more, because you know that as we go to long discussion, the everybody will be puzzled, or everybody will feel, that what is this. So not too much today. I hope you understand my wonderful topic today, vertigo. Thank you.